Throughout the 2 years of the COVID pandemic so far, the question I hear most people say is, well, we hear one doctor say this, one doctor say another thing, and one politician say this, another politician say another thing. You're used to it with politicians, but not with doctors. So, Dr. Neil Rao is joining me today. He is an infectious disease specialist, a medical doctor, and I want to put the question to you. If it's medical science, why is there not just one opinion and people know what to do or not to do?
Well, the science itself is objective, but the interpretation of the conclusions isn't. So some people can walk away with completely different conclusions about what a study means.
Why? I mean, 2 and 2 is 4, not 3, not 5. I mean, if you know what this virus is and it's medical science, why is it definitive? Instead of having Dr. Tam in Ottawa saying, yes, masks, no masks. Yes, it's spread by coughing. No, it's not spread by coughing.
So some of the stuff on transmission, I think we agree on more. I don't think you're going to have so much debate on that anymore. At the beginning, people were not sure whether it spread without symptoms or with symptoms. Now we have more clarity that it can spread even without symptoms, but mainly with symptoms or just before you get symptoms.
Right.
But I'll give you an example of where it's not so clear. You know, when we talk about things that we do at a community level in terms of the impact on transmission, the level of infection starts to drop when you do a whole bunch of things together. You don't know which of those individual things made the big benefit or big difference. So in the UK, you can see they're moving away from masks in the community because there's a lot of uncertainty as to how much masks do in the community versus in a hospital setting.
That's after 2 years. Did it take 2 years to learn that, to figure that out?
I think we knew sooner, but people finally have the guts to make actual decisions based on the science. So there could be a big lag.
We don't have many in Canada.
So a lot of it is political. So sometimes the science will say, listen, unvaccinated people now transmit with the same risk as those who are vaccinated. This is an inconvenient truth that's become evident in the last, I'd say, 2 to 3 months. It's clear that being vaccinated doesn't stop you from potentially transmitting the infection if you get infected.
Right. And vaccinations are no guarantee against infection.
They aren't. The only thing they are a guarantee against is a bad outcome from the infection. So I call it a good seatbelt for some, an airbag for someone who has a lot of risk factors, but it's not a collision prevention system. It won't actually stop you from hitting the virus. It's a question of what happens when you hit the virus.
Okay, so I'll put the basic question to you. Should people be vaccinated?
Yes, but
it helps.
But we don't have to go after every single person. So in other words, a 5-year-old or a 10-year-old doesn't have the same impact in terms of preventing healthcare surge that's going after an 80 or a 90-year-old. So everybody over 60, for the most part, should be vaccinated unless they have some medical exemption. Once you get to younger and younger people, especially kids, if parents want to vaccinate their kids, fine, but the real benefit to the kid is less than it might be than we originally thought. That's what I'm trying to say.
Dr. Rao, you said it very, very well. And you said over 60, so I have a few years to be vaccinated. 3 minutes. Thank you very, very much for watching and for engaging in the 3 minutes, which will carry you through most discussions for the day. 2022 is going to be a very, very tough year. Stay with us. Please tell your friends to subscribe and PayPal. Thanks.